Welcome back to part 2 of the ADHD treatments. Let's jump right in. We left off with non-stimulants. So jumping right into non-stimulants, Strattera atomoxetine was really the big player in America for many, many years. It's the one that's probably easiest to get covered by insurance. It's the least expensive one. And in my opinion, in here, it's less potent maybe than some of the other ones, but also may have less side effects. Okay, so that's atomoxetine Strattera, which is readily available. Then there's a newer version called Qelbree. Qelbree has a really interesting story to it. It's actually used in Europe since the 1970s, roughly, but it was used as an SNRI, a serotonin norepinephrine reuptake inhibitor, which, as you know, we have some of those in America, like Pristiq, Effexor, and similar. Cymbalta is one. So it was used in that sense, but then it got an approval here recently as a non-stimulant for ADHD. So kind of an interesting story. This, in my experience, these two, Strattera and Qelbree, are probably good for the inattentive type of ADHD, and these three are probably better for the hyperactivity type of ADHD. And then the subtle differences are a little bit nuanced and would be case-by-case difference. Now, moving on, clonidine and guanfacine. For a moment here, the way these meds work are centrally acting antihypertensive. So remember, any med that goes to the brain, psychiatrists studied. Okay, any med that goes to the brain, we studied. So we studied these antihypertensive that were centrally acting. And what it turns out is that they help with focus, mood, impulsivity, hyperactivity, anxiety, and other things. Okay, so these are examples of that. And I think it's cool that you can lower blood pressure from the brain. I mean, we could just nerd about that for a second. But regardless, we use it in psychiatry. Guanfacine also comes with Intuniv, which is actually the extended version. So this comes in two versions. It comes in an immediate release and an extended version in ER, and that is what Intuniv is. And again, real good for hyperactivity, aggression, impulsivity, and similar types of symptoms. Wellbutrin is also called bupropion. People are surprised to see this on the list. I want you to think of this as like a third-line treatment for ADHD, meaning it's not the best ADHD medicine out there, but it can help with focus, because remember, this is a DNRI, dopamine norepinephrine reuptake inhibitor. So you're actually getting 2 out of the 3 neurotransmitters that the stimulants are doing, but in a non-addictive way. So I do think it's a very interesting option in somebody that, let's say, has depression, or maybe they want to quit smoking, but they also need a little bit of help with focus. It's got to be in the running. Hit me up in the comments.